Have you ever felt a quiet worry settle in your chest when you hear the words brain damage, especially as you grow older and value your memory, your independence, and the clarity of your thoughts more than ever? A patient of mine once shared something that stayed with me. She said, "Doctor, I am not afraid of getting older. I am afraid of losing myself." She was not talking about illness. She was talking about identity, dignity, and the small daily routines that make life feel familiar and safe. Now I want you to imagine this for a moment. You are sitting at your kitchen table in the early morning. The house is quiet. Your mind feels clear. That sense of calm is not fragile. It is something worth protecting. I am Dr. Evelyn Carter, and I have spent decades caring for older adults in hospitals, clinics, and homes. When topics like rare viruses and brain health appear in the news, it is natural to feel uneasy. Hearing the words Nipah virus and brain damage can sound frightening at first, but understanding does not mean danger is near. It means we are choosing calm awareness instead of fear. Nipah virus is a rare infection that doctors study because of how it can affect the brain in certain cases. It is not something most people in the United States will ever encounter. I want to be very clear about that. We are talking about it today not to alarm you, but to help you understand what doctors observe and why knowledge matters more than worry, especially as we age. From a medical perspective, I have seen how fear alone can exhaust the aging brain. Stress disrupts sleep, routines, and emotional balance, which are the very things that protect memory and cognitive health. Simple science tells us that calm, stable routines help the brain stay resilient. In the next part, I will gently explain how viruses can affect the brain and what doctors actually look for without panic or pressure. If this feels helpful to you, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. This channel is a place you can return to whenever health questions feel heavy. For now, stay with me, breathe, and know you are not alone. How viruses can affect the aging brain. As we grow older, the brain becomes a little quieter, a little slower, and often more sensitive to changes happening inside the body. I have seen this gently and repeatedly over the years, sitting beside patients who were once sharp and quick, now needing a bit more time to find their words or steady their thoughts. This is not weakness. It is simply how biology unfolds with age. When a virus enters the body, the immune system responds by creating inflammation. In younger people, that inflammation often rises and settles quickly. In older adults, it can linger. I often explain it this way. Imagine your brain as a well-organized neighborhood with clear roads and steady traffic. Inflammation is like unexpected construction. Messages still move, but more slowly, sometimes with confusion or delay. That is what doctors mean when we say a virus can affect the nervous system. The brain and the immune system are closely connected. When the body is fighting an infection, the brain feels it. This can show up as fatigue, trouble concentrating, or feeling mentally foggy. I have cared for many older adults who became temporarily confused during an illness, even when the infection was not directly in the brain. Their families were frightened, thinking dementia had suddenly appeared. In many cases, once the infection resolved and routines returned, clarity slowly came back. What matters most is understanding that the aging brain recovers at a different pace. Healing takes longer, not because the brain is broken, but because it has been working hard for decades. Science shows that inflammation affects brain cells more strongly in older adults, especially those already managing conditions like high blood pressure, diabetes, or mild memory changes. This does not mean damage is inevitable. It means the brain asks for patience and care. From my experience, the most important support during illness is calm. Loud worry, disrupted sleep, and constant fear place extra strain on the brain. Simple routines, familiar voices, gentle reassurance, and rest are powerful medicine. The brain responds not only to treatment, but to environment and emotion. When we talk about viruses and brain health, especially rare ones, the goal is not alarm. It is awareness paired with dignity. Understanding how the aging brain responds helps us protect it with kindness, steadiness, and respect. Stay with me as we continue this conversation together. Senior Health Daily is here to walk with you, one calm step at a time. In medicine, the term brain damage often evokes concern, but it's important to understand that it refers to a broad spectrum of changes within the brain. Not all brain damage is permanent or severe. In fact, many cases involve temporary or reversible alterations. This distinction helps to dispel common fears and misconceptions surrounding the phrase. By recognizing the varied nature of brain changes, we can approach the topic with greater clarity and less apprehension. Stressors such as illness, dehydration, and changes in medication can have a significant impact on brain function, particularly in older adults. These factors may lead to temporary confusion, memory lapses, or difficulty concentrating, symptoms that can closely resemble those of dementia. However, it's important to recognize that these changes are often reversible. With timely identification and appropriate care, many individuals recover their usual cognitive abilities once the underlying issue is addressed. Understanding this distinction helps prevent unnecessary worry and ensures that treatable conditions are not mistaken for permanent decline. Recovery from brain injuries or neurological challenges can often take longer than expected, especially as we age. However, research continues to show that the brain retains a remarkable capacity to heal, adapt, and reorganize itself throughout life. This ongoing ability means that meaningful progress is possible, even in later years. Patience becomes essential during these extended recovery periods, as does the presence of a supportive environment. Encouragement, understanding, and tailored care can make a significant difference in fostering successful outcomes. Fear can significantly worsen brain dysfunction, making symptoms more pronounced and recovery more challenging. The words we choose when discussing brain health matter greatly, as careless language can unintentionally increase anxiety and distress. By responding to changes in the brain with empathy, patience, and emotional support, we help create an environment that encourages healing. This approach not only aids recovery, but also preserves the dignity of those affected. Understanding and compassion are essential in supporting individuals through their journey toward improved brain health. What makes Nipah virus different? When doctors talk about Nipah virus, it is not because it is common, and it is certainly not because it is spreading quietly through everyday life. It draws medical attention for a different reason. It helps us understand how certain infections can affect the brain under very specific conditions. That distinction matters, especially for older adults who deserve facts without fear. Nipah virus is considered rare, and most doctors in the United States will never see a case in their lifetime. I want to say that clearly, because rarity changes how we should emotionally respond. What makes this virus interesting to researchers is not how often it appears, but how it behaves in the body when it does. In some cases, it affects the brain more directly than many common infections. From a scientific perspective, Nipah virus can cross into the central nervous system. When that happens, it may trigger inflammation in brain tissue. Inflammation is the body's natural defense, but in the brain, even small changes can feel significant. I have seen similar patterns with other illnesses that stress the brain. The symptoms often reflect disruption, not destruction. Confusion, slowed thinking, or changes in awareness can appear when brain cells are under pressure. Doctors pay attention because the brain controls so much of what makes us who we are. Memory, balance, speech, emotion, and judgment all live there. When a virus interferes with those systems, even temporarily, it teaches us important lessons about vulnerability and resilience. What matters is that these observations come from clinical care and careful study, not from alarming headlines. In real medical settings, doctors look for patterns. We observe how symptoms appear, how long they last, and how people recover. With Nipah virus, what stands out is the brain's response during the illness, not a guaranteed outcome afterward. Recovery varies, as it does with many conditions, especially in older adults whose healing rhythms are slower but still meaningful. I want to emphasize something I have learned after decades of caregiving. Rare does not mean inevitable. Attention does not mean threat. Studying a virus does not mean it is approaching your doorstep. It means medicine is learning how to protect the most sensitive parts of the human body. For seniors, the takeaway is not alarm, but understanding. The brain responds best to calm information, steady routines, and trust in care. When we understand why doctors study certain illnesses, we remove mystery and replace it with perspective. That perspective helps protect emotional safety, which is just as important as physical health. Early neurological signs. Doctors watch. For when doctors talk about neurological signs, we are not talking about ordinary forgetfulness or the occasional misstep that comes with age. I want to begin by saying that clearly, because too many older adults worry that every small change means something serious. In my years of practice, I have learned that context matters just as much as symptoms. In clinical settings, doctors watch for changes that appear during illness or shortly after. These are not subtle everyday moments. They are noticeable shifts from a person's usual state. A patient who is normally alert may seem unusually drowsy or confused. Someone who walks steadily may suddenly struggle with balance in a way that is new for them. These changes stand out because they are different from that person's normal rhythm. One of the most common signs doctors observe is altered awareness. This can look like difficulty following a conversation, slower responses, or moments of disorientation. In older adults, this often occurs when the body is under stress from infection, dehydration, or fever. I have seen patients who could not tell me the day or where they were during an illness, yet returned to full clarity once their body recovered. Coordination is another area we watch carefully. The brain helps guide movement, so inflammation or stress can interfere with balance or fine motor control. Again, this is not about an occasional stumble or stiff joints. It is about a sudden change that appears alongside illness. Doctors look for patterns, not isolated moments. What is most important is that these signs are observed in medical contexts. They are not meant for self-diagnosis at home. I worry when people begin monitoring every thought or step, searching for meaning. That kind of constant vigilance creates anxiety, and anxiety itself can cloud thinking and memory. From a caregiving perspective, observation is about noticing changes with curiosity, not fear. It is about asking, is this different from usual? Did it appear with illness? Is it improving with rest and care? These questions guide doctors toward appropriate support without jumping to conclusions. The brain, especially an aging one, responds best to calm. When caregivers and patients remain steady, the brain has space to heal. Many neurological changes during illness are temporary signals, not permanent losses. Understanding what doctors watch for helps remove fear from the unknown. It reminds us that medical observation is thoughtful and measured. Senior Health Daily is here to help you feel informed without feeling overwhelmed, and to remind you that patience and dignity, seniors, immunity, and brain resilience. As the body ages, the immune system changes in quiet, gradual ways. I often describe it to my patients as a system that has grown wiser but also more deliberate. It still knows how to respond, but it may take longer to recognize a threat and longer to settle down afterward. This is not a failure. It is the natural result of a lifetime of protecting you. In older adults, the immune response can be less precise. When an infection appears, inflammation may last longer than it would in a younger body. That lingering inflammation can affect the brain, especially in seniors who already manage other health conditions. I have seen how this can temporarily cloud thinking or disrupt sleep and mood. Families sometimes worry that the brain is becoming weaker. What is really happening is that the brain is working harder under stress. Resilience does not mean resistance. It means the ability to adapt and recover with the right support. The aging brain is resilient when it is protected by routine, rest, and emotional safety. Science shows that predictable daily patterns help regulate inflammation and support brain function. Simple things like consistent sleep times, familiar meals, and gentle movement make a measurable difference. From a caregiving perspective, vulnerability is not something to fear. It is a signal to slow down and care more thoughtfully. When older adults become ill, they benefit from quieter environments, fewer disruptions, and reassurance from familiar voices. I've watched patients improve simply because someone sat with them calmly, spoke softly, and allowed them time to respond. Patience plays a powerful role in healing. The brain does not rush its repair. It works steadily, forming new connections and restoring balance when given the chance. Stress and urgency interrupt that process. Calm supports it. This is why emotional safety is just as important as medication. I often remind seniors that needing more time does not mean losing strength. It means honoring the body's pace. The immune system and the brain are partners, and both respond best to kindness and consistency. Understanding this helps reframe aging. Changes in immunity are not warnings of decline. Staying informed without becoming afraid, over the years, I have noticed something important in my patients. Those who stay informed in a calm and balanced way tend to feel steadier when health news appears. Those who absorb information through fear often feel overwhelmed long before anything touches their body. Information itself is not harmful. How we receive it matters deeply, especially as we grow older. When rare illnesses are mentioned in the news, the mind can wander quickly. I have sat with seniors who told me they stopped sleeping well after reading alarming headlines. Their routines changed, their appetite faded. Their memory felt less reliable, not because of illness, but because worry had taken up too much space. The brain responds to fear as if it were a physical threat. Staying informed does not mean watching every update or searching endlessly for answers. It means choosing sources that respect your emotional safety. It means learning at a pace that feels steady, not urgent. I often encourage my patients to ask themselves a simple question. Does this information help me feel grounded, or does it make me anxious? That answer usually guides them well. Connection plays a powerful role here. When people feel alone with their health questions, fear grows louder. When they feel accompanied, fear softens. This is one of the reasons Senior Health Daily exists. It is not just a place for information. It is a place for reassurance and shared understanding. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Staying connected allows you to return whenever questions arise, without having to face them alone. From my caregiving experience, I have seen how community calms the nervous system. Knowing that someone is speaking gently, consistently, and honestly makes it easier to absorb complex topics without distress. This is especially important for seniors, whose brains respond best to familiarity and trust. You deserve information that supports your dignity, not information that frightens you. Learning should feel like a conversation, not a warning. As we move forward together, remember that calm awareness is a form of protection. Senior Health Daily is here to walk beside you, offering clarity without pressure and companionship without fear. Dementia, delirium, and viral confusion. One of the most painful moments I witness as a doctor happens when a caregiver looks at someone they love and says, "This is not who they were yesterday." That fear is real, and it deserves tenderness. Sudden changes in thinking or behavior can feel like a door closing forever. In many cases, it is not. Dementia is a gradual condition. It develops slowly over time, often over years, with patterns that unfold step by step. Memory changes appear first, then language, then daily function. It does not arrive overnight. When someone seems suddenly confused during an illness, that is usually something very different. What many caregivers are seeing in those moments is delirium. Delirium is a temporary brain stress response. It often appears during infections, dehydration, fever, or after medication changes. The brain becomes overwhelmed and thinking becomes cloudy. Attention drifts. Awareness fluctuates. A person may seem alert 1 hour and confused the next. That fluctuation is a key clue. I have cared for patients who could no longer recognize family members during an infection. Their loved ones feared dementia had suddenly taken hold. Yet days or weeks later, after the illness passed and routines returned, those same patients were once again telling stories, remembering names, and engaging with life. The brain had not disappeared. It had been under strain. Viruses can contribute to this temporary confusion by triggering inflammation and exhausting the body. In older adults, the brain feels that stress more strongly. This does not mean the brain is failing. It means it is asking for relief. Rest, hydration, familiar surroundings, and gentle reassurance make a remarkable difference. For caregivers, this distinction matters deeply. Responding to delirium with panic can worsen confusion. Responding with calm often helps the brain find its way back. Speaking slowly, maintaining routines, keeping lights soft, and offering repeated reassurance supports recovery. Dementia and delirium are not the same story. One is a long journey. The other is often a passing storm. Knowing the difference protects hope and dignity for both seniors and those who care for them. If you are caring for someone and notice sudden changes, trust that observation, but do not assume the worst. Many changes are reversible. The brain, even an aging one, holds remarkable capacity for recovery when supported with patience and love. Senior Health Daily remains here to help you navigate these moments with understanding, steadiness, and compassion. What science knows and what it does not yet know. One of the hardest things for many people to accept about medicine is that it does not have every answer. After all these years in practice, I can tell you that uncertainty is not a failure of science. It is a sign that learning is still happening. I have seen how honesty about what we know and what we are still studying brings more peace than false certainty ever could. Science knows a great deal about how the brain responds to illness. We understand inflammation, immune responses, and how stress on the body can affect thinking and awareness. We know that older brains are more sensitive to these changes, and that recovery often takes time. We also know that many cognitive changes during illness are temporary and improve with care, rest, and routine. These are well-observed patterns supported by decades of research and clinical experience. What science continues to study is why some people recover quickly while others take longer, and why certain infections affect the brain more noticeably in specific individuals. With rare viruses like Nipah, there are fewer cases to observe, which means learning moves more slowly. That slowness can feel uncomfortable, especially when headlines suggest urgency. In reality, careful study protects patients far better than rushed conclusions. Uncertainty does not mean danger is approaching. It means doctors are paying attention. Monitoring symptoms, collecting data, and following patients over time are all acts of protection. They allow medicine to respond thoughtfully rather than react emotionally. I have watched how this careful approach leads to better outcomes and fewer unnecessary interventions. From a caregiving standpoint, uncertainty asks us to remain calm. The brain responds poorly to constant alarm, but well to steady reassurance. When we accept that learning takes time, we create space for patience. That patience supports healing more than speculation ever could. I often remind my patients that not knowing everything does not mean being unprepared. It means staying attentive, informed, and grounded. Medicine evolves because doctors and scientists continue to ask careful questions and listen closely to what the body tells us. For seniors and caregivers, this perspective matters. It allows trust to grow, not fear. Calm monitoring, respectful observation, and ongoing research are signs that care is active and protective. Senior Health Daily exists to help you sit comfortably with uncertainty, knowing that learning and compassion move forward together. Protecting brain health through daily habits. Over many years of caring for older adults, I have learned that the brain finds its greatest strength in ordinary days, not in dramatic changes or complicated plans, but in the quiet rhythm of daily life. When the brain feels safe and supported, it steadies itself almost naturally. Sleep plays a central role in this process. I have watched how even a few nights of poor rest can leave an older adult feeling unsettled, forgetful, or emotionally fragile. When sleep returns to a familiar pattern, clarity often follows. The brain uses rest to organize memories and restore balance. It does this best when bedtime and waking feel predictable and unhurried. Hydration is another gentle support that is often overlooked. A brain that lacks enough fluid struggles to focus and regulate mood. I have seen confusion ease simply because someone began drinking regularly again after an illness. The change can be subtle but meaningful. The brain responds quickly when its basic needs are met. Emotional calm may be the most powerful habit of all. The nervous system listens closely to emotion. When the environment is loud, rushed, or tense, the brain stays on alert. When voices are soft and routines familiar, the brain relaxes into clarity. I have seen patients think more clearly simply because the room grew quieter and someone spoke to them with patience. Familiar structure also matters deeply. Simple daily patterns like morning light through the same window, meals at known times, or a familiar chair can anchor the brain. These small signals tell the mind that it knows where it is and what to expect. That sense of familiarity protects dignity and reduces stress. None of these supports require effort or perfection. They are not tasks to complete or goals to reach. They are gentle companions to aging. The brain does not ask for control, it asks for consistency. From my caregiving experience, I have seen how honoring these quiet habits helps older adults feel more themselves, even during times of illness or uncertainty. Stability creates room for resilience. The brain responds with gratitude when treated kindly. Protecting brain health is not about preventing every challenge. It is about creating a steady foundation so that when challenges appear, the brain has something solid to return to. Senior Health Daily remains here to remind you that your everyday routines hold more power than you may realize, and that care can be calm, simple, and deeply human. The role of trust between doctors and seniors. As I look back over my years in medicine, one truth stands out more clearly than any diagnosis or treatment. Healing works best when there is trust. Not rushed trust or blind trust, but the kind that grows when people feel heard, respected, and taken seriously. Older adults carry a lifetime of experience in their bodies. They know when something feels different. They also know when something feels familiar and manageable. Trust begins when a doctor listens to that knowledge instead of dismissing it. I have sat with seniors who felt relieved simply because someone finally slowed down and listened to their concerns without interruption. Asking questions is not a sign of weakness. It is a sign of engagement and self-respect. I encourage every patient to speak openly about what they notice, what worries them, and what feels unclear. Good medical care is a conversation, not a lecture. When seniors feel comfortable asking questions, fear loses its grip and understanding takes its place. Trust also means learning where to place attention. The internet offers endless information, much of it alarming and out of context. I have seen patients arrive anxious after reading frightening stories that had little relevance to their own health. Noise can drown out intuition and strain the mind. Trusting your care team helps filter that noise and brings focus back to what truly matters. The body communicates quietly. Changes in energy, appetite, sleep, or mood often speak before serious symptoms appear. When seniors trust their own observations and share them with a doctor who listens, care becomes more effective and less frightening. That partnership honors dignity. From a caregiving perspective, trust creates safety. Safety allows the brain to relax. A relaxed brain thinks more clearly, remembers more easily, and heals more steadily. This is not theory. I have witnessed it again and again. Medicine works best when it respects the whole person, not just the condition. Trust supports that respect. It allows seniors to feel confident in their care and grounded in their bodies. As we bring this conversation together, remember that you deserve care built on patience, understanding, and mutual respect. Senior Health Daily remains a place where your questions are welcome and your experiences matter. Stay connected with us. We are here to walk alongside you with calm guidance and steady support every step of the way. As we come to the end of our time together, I want to slow everything down and let the quiet settle. Learning about rare neurological illnesses does not mean you are in danger. It means you chose understanding over fear. That choice matters more than you may realize. I have seen many older adults face health questions with calm curiosity instead of panic, and again, that calm became a source of strength. Over decades of caregiving, I have witnessed remarkable resilience. I have watched bodies recover in their own time and minds regain clarity when given patience and respect. Aging does not mean losing your ability to adapt. It means your body asks for gentler care and steadier rhythms. That is not weakness. It is wisdom earned through living. Brain health is not about control. It is not about watching every thought or fearing every change. It is about connection, routine, and kindness toward yourself. Your body has carried you through years of work, love, stress, and joy. It continues to adjust, even now, doing its best to support you in quiet ways. If this conversation stayed with you, I hope it brought a sense of steadiness. You do not need to hold all the answers today. You only need to stay open and patient with yourself. Senior Health Daily is here whenever health questions feel heavy or confusing. There is no urgency and no pressure. Just an open door, calm guidance, and a steady presence as you continue aging with dignity and trust in your body. I am grateful you spent this time with me.